Access to big data is changing the way we interpret the world around us, and eye care is no exception. The Fight Glaucoma Blindness Registry is a database of glaucoma patients from all over the world, and Dr. Colin Clement has used this wealth of data on recent research that is upending the way we think about trabecular meshwork bypass stenting in MIGS.
My name's Colin Clement. I'm a cataract and glaucoma specialist based in Sydney, Australia. So it's a university-supported registry that is web-based. It's got support from university as well as industry, and it's a storage and data tool that allows you to collect information about your patients in the clinic and analyse that from a personal audit point of view, but also to generate research. Well, it's got a couple of advantages over other methods of research. It's a large data set, and it represents what is happening at the coalface. So this is what is happening in day-to-day practices around the country, and it gives us a snapshot of true outcomes rather than what would happen in a clinical trial setting, for example. Anyone can use the registry, any clinician. They just need to register to get an account. They need to go through a training process to learn how to use it properly, and then from there it's available to use. Obviously, they're similar devices in that they're transtrabecular outflow procedures that aim to reduce intraocular pressure as a means of treating glaucoma. There has been some comparative studies in the past, but there are some issues with the study. So the one that most people would know about is Compare, where standalone Hydrus was measured against standalone first-generation iStent and outcomes reported after 12 months. The issue with this study from a clinician's point of view is that most of the stents we are implanting are not standalone, they're actually in combination with cataract surgery, and also we're almost exclusively using second generation iStents. We're no longer using the first generation stents. So we've gone to the registry exactly for that purpose to find out how does the Hydrus compare to second generation iStent in combination with cataract surgery. The main outcomes we're interested in that study were change in intraocular pressure, change in medications, and adverse events over a 24-month period. As we went into the database and did a search for all patients that had undergone cataract surgery combined with either Hydrus or second-generation iStent, and putting those parameters in, we got 120 cases of Hydrus combined with cataract and 224 cases of iStent second-generation combined with cataract. So propensity score matching is a way to negate any potential bias by bringing the two comparator groups, the Hydrus and the iStent, in line with one another in terms of any variable that might affect the outcome. So what we ended up with is 75 eyes in each group that were fairly equally met. There's trends towards better outcomes for the iStent group in the three main variables we looked at, so IOP reduction, medication reduction, adverse outcomes. When we compared the 24-month outcomes between those two groups, we found that in the iStent, there'd been a 3.1 millimetre reduction in mercury, whereas in the Hydrus group, the reduction was slightly less. It was 2.5 millimetres of mercury, but that was not statistically different from one another. And then if you do the same comparison for medications, iStent group was associated with a 1 medication reduction, whereas the Hydrus group was a 0.5 medication reduction. So that was verging on significant, but not quite. So in terms of adverse events, number of additional surgeries required was slightly higher in the Hydrus group. Although there was no major statistical difference in the number of adverse outcomes between the group, again, there was a trend towards more adverse outcomes in the Hydrus group. Well, I think what this study demonstrates is that of all the variables that a surgeon might take into account when deciding what angle-based MIGS to use, and specifically when they're comparing Hydrus versus iStent, if it's efficacy and safety they're concerned about, then iStent would certainly be my choice device. There's scope to do a lot of research on iStent, and we can really narrow in further on these results and look at specific subpopulations, advanced glaucoma or mild glaucoma or secondary glaucomas. We can track the rate of visual field change before and after an intervention. The possibilities are endless.
Dr. Clement's research is just one example of how we can use powerful big data tools like the Fight Glaucoma Blindness Registry to re-examine the way clinicians treat glaucoma and eye disease. Head to the SaveSight Registry's website where you can find the Fight Glaucoma Blindness Registry for more information.